Hey, I'm Dr. Paul with Move Toward Wellness, and I wanted to put an Ask Dr. Paul segment on video because I had a patient last week that had a really good question. She had been dealing with some health issues, and she had been on the internet, done some research, asked her doctor's questions, talked to her friends, and her question to me was, how do you take all the information that you're getting and come up with a good answer and a good solution? So the best advice I could give her, and the best thing that I can tell you, is that you need to start asking better questions, different questions. The quality of the questions you ask will absolutely determine the quality of your life. A good example is modern medicine. With all the advances we make in tests and procedures and medications, we keep getting sicker and sicker and sicker. And the main reason is we're not asking the right questions. If you look at blood pressure, for example, if you go to the doctor and they find that you have high blood pressure, the question that they're going to ask is, how do we lower your blood pressure? And they're going to give you a medication, and guess what? It works. It lowers the blood pressure. The question I would have asked is, why do you have high blood pressure? There's an underlying cause of that. And even though the medication will bring your blood pressure down, that's not going to move you towards health. In fact, over time, it's going to move you away from health because you're going to get sicker because of the side effects of the medication and the fact that the underlying cause of your problem isn't being addressed. So why do you have high blood pressure? Is it nutritional, the food you're eating? Is it lack of exercise? Is it stress? You've got to get to the cause of these solutions, not just health, but in every single aspect of your life. One of the most common things I see in this office when it comes to little kids is recurring ear infections. By the time I see them, they've often had half a dozen to a dozen ear infections and have been on half a dozen to a dozen rounds of antibiotics. And what's happened is the doctors before were asking the wrong questions. They were looking at the kid and saying, well, you have an ear infection. What do I do to reduce the ear infection and wipe out the infection? Well, the logical answer is antibiotics. And they work. They wipe out the infection. But if the underlying cause isn't addressed, the infection comes back. And so they give another round of antibiotics. The question I ask is, why are you getting ear infections? What is not happening properly that's causing you to get ear infections? Because even though antibiotics wipe out the infection, they're not addressing the cause of the problem. And when we ask why they're getting ear infections, we're going to get a better result. A lot of times it can be nutritional, some type of food allergy. It can be structural, some cervical spine issues from a tough birth that are preventing the proper drainage of the fluid, which causes the fluid to get backed up and causes an ear infection. So we get great results with that kind of stuff, not because we're doing something better, it's because we ask different questions. We're doing something different. And these questions, all the questions you ask are going to be important. I mean, don't you think a question like, why me? Don't you think a better question is, what can I learn from this? Or questions like, why am I so broke? Wouldn't a better question be like, how do I become wealthy? Just changing the wording and changing the way you phrase your questions is going to make a big difference in your life. Weight loss is a huge problem in this country, and all the gimmicks and programs and supplements and everything on the market don't seem to make a difference, because the question you're asking is, how do I lose weight? I can give you a half a dozen things right now and guarantee if you follow those, you'll lose up to 30 pounds in 1 month. The problem is that doesn't move you towards health. If the question is, how do I get healthier? And I give you ways to get healthier, the natural byproduct is you lose weight. But if you focus on just losing weight and you do one of these other gimmicky kind of things, you may lose the weight, you may not, but even if you lose the weight, you're going to probably do it in an unhealthy way. It's going to be short term, and many people end up gaining more weight back than they initially started with. And that's why they end up on these yo-yo kind of fluctuations. So the questions that you ask are super, super important. The books that I studied and the books that the doctors in medical school studied are the same books. One book is a physiology book. It's a big, thick book that explains all the processes in the body and how they work. We all agree on how the body works. The difference comes into how the questions that we ask when the problems start to show up. The main questions that I always ask is, what can I do to help the body to function better? The medical model is, What can we put in the body to change that? What can we cut out to change that? What can we do to change what's going on? And they'll get the results, they'll change it, but the long-term effect isn't better health, it's just a change in your symptoms. So the main question that you need to start asking when it comes to health and wellness is, what can I do to help my body function better? What can I put in my body, or what can I do to my body to help it function better? And what can I get rid of and eliminate that's harmful to my body? When you start adding the right things and get rid of the bad things, the natural progression is going to be that you're going to move towards health. You're going to get healthier. And when you get healthier, sickness goes away. So I don't care what you have, how old you are, what ethnic group you come from. If you eat, move, think, and interact healthier, in a healthier way, your health goes up and sickness goes down every time. And there's no adverse effects to that. So the questions that you ask are going to be super important, and I want to encourage you to start looking at the questions you're asking when it comes to health. If you like the information, click the like button. If you know somebody that could benefit from the information, please pass it on. If you have a comment or a question or something to share, please post it on the site. I'd love to hear it. I'm going to send more information. We're going to put more information on video for you. I hope the information you're getting is helpful. Start asking better questions, and I can guarantee you're going to get better results in your life. The quality of your life is going to go up. So thanks. I appreciate your trust. Talk to you soon.